All right, welcome back, everyone. It's really my pleasure to introduce my colleague and friend, Dr. Rob Dietz, for our third keynote. Dr. Dietz is an assistant professor of pediatrics and anesthesiology at the University of Colorado Anschutz Medical Campus and neonatologist at the campus. As a physician scientist, Dr. Dietz's research focuses on ischemic injury in the developing brain. Having attained his dual doctorate at the University of New Mexico, Dr. Dietz completed residency in pediatrics at the University of Chicago and fellowship training at the University of Colorado. He's been caring for neonates at the Children's Hospital Colorado since 2013 and serves on the Faculty Wellbeing Advisory Committee. Thank you so much, Rob, for your time.
Thank you so much. I'm going to go ahead and share my screen here. Oh. Okay. Can you see that okay?
Not yet.
Let's see. How about now?
No.
Okay.
You can also share from our end if helpful.
Here you go.
Try again.
Let me try one more thing here.
Great. It's not in presentation mode. Perfect. Now it's excellent. All right.
Perfect. All right. So I've had the opportunity to work with many of you, and some of you I don't know at all. And so I'm a neonatologist at the University of Colorado in Children's Hospital, and I am a recovering alcoholic. I've been in recovery for almost 5 years. And I should add that I didn't plan this. I didn't wake up one day and decide that I would be an alcoholic. As a pediatrician, I had taken care of many infants and children and knew the devastating effects that alcohol could bring to the child, the family, the community, the society at large, many of which we talked about today. And unfortunately, even though I had this information, I was not immune. And today I'd like to tell you how I got here. Before I get too far, I'd like to say that so much of Vic's story that he shared earlier resonates with me, and you'll hear a lot of the same points. Yeah. And like Vic, if any of this resonates with you, that would be icing on the cake. So I don't know for sure when my struggles with alcohol first arose. I remember getting into a fist fight in the 7th grade, and I was told that being suspended from school could impact my academic pursuits forever. I had already seen myself going into medicine or science. So from that point on, I think I only had 2 grades lower than an A until I got into the MD PhD program at University of New Mexico, almost 10 years later. Getting into that program, I felt like an imposter among so many talented students, and had a lot of battles against perfectionism and anxiety, and the stresses of life, and love, and parenthood built up, and I would occasionally let loose a few drinks as a way to cope. My grandfather was an alcoholic. My dad's brother and sister were alcoholics. My mom's brother was an alcoholic. I enjoyed the occasional bourbon and Coke. I found that after graduating medical school and going to residency, the culture was that talking about drinking after a shift was encouraged, and I fully leaned into that culture. And I should have realized that when I started sneaking extra drinks here and there, and lying to my wife about how much I'd been drinking, I should have known that that was a problem. I would drink because it was a bad day. If I lost a patient, if I didn't interact, had a poor interaction with somebody, I'd drink if I had a great day. And the truth is, I didn't really need an excuse to drink at all. And this problem would go on through residency, always after work. I never drank before work, never during a shift. I never got in trouble with law enforcement. But I also never owned up that I had a problem. And probably because I didn't have significant consequences, at least professionally. I had become a physician scientist. I had graduated from med school, got into residency, got into the fellowship of my choice. But it certainly became a problem in my family. The consequences became too many. I would quit drinking hundreds of times. Usually the mornings after drinking too much, but would start drinking again the day, that day or the day after. My coping skills for life and life's problems were poor. And these poor coping skills had caught up to me. So finally on January 28th, 2017, I sought help during one of the darkest and most shame-filled times of my life. So I'd like to use this as a point to dive into the problems with physicians using substances and hope for recovery. So disclosure, I have no financial disclosures to talk about. I also have no informal training in addiction medicine, but I have a lot of experience talking with alcoholics and healthcare workers in recovery, from which I'll draw a lot of experience today. Also, I am grateful to those of you who have kept your cameras on, so I can feel like I'm in the middle of that arena that Susan was talking about. Although my arena is definitely Red Rocks over on the west side of Denver. We've already talked about some of this before, how big of a problem alcohol is. This is data published in 2015 looking at age-related alcohol deaths from 2010 to 2012. The darker the color, the higher the problem. This is cause of death per 1 million people. You see that the Rocky Mountain region has among the highest rates in the country. As we've also talked about, alcohol use disorder is prevalent. This was a paper that came out a couple of years ago now, and you see that they look at prevalence of alcohol use disorder defined by DSM-5 and found that over the last 12 months, about 14% of the people they surveyed had that could be diagnosed with alcohol use disorder. In the last 12 months, it was certainly males over females. Native Americans were the highest race or ethnicity, and afflicted mostly younger people in their 20s. Over the lifetime, you see up to 30% of people can have a problem with alcohol use disorder. Again, men more than female, and younger ages more than older ages. And we know from this data from the NIH website that over the last couple of years, the numbers of people who died from alcohol-related causes about 95,000. The number of adults who have an alcohol use disorder in 2019, and this is before COVID, about 14.5 million Americans. You look at adolescents, the number is almost 500,000. There's about 10% of US children aged 17 and younger who live with a parent with alcohol use disorder. And similar to what Susan showed earlier, the rates of alcoholism have risen over the past 25 years. And what's most alarming, I think, is the rapid rise in people over 65 years old, about 50% increase. And women, since the late 1990s, have had an 80% increase in alcoholism. So what is addiction? There's been a lot of debate over the past decades and really longer than that, centuries maybe, over whether addiction is a disease or a choice. But in more recent decades, addiction has been found to be more consistent with a chronic, relapsing, remitting disease with brain chemistry changes that occur that involves continued use of and compulsive use of a substance or behavior. The drugs of choice can certainly be the things that we talked about today: opioids, alcoholism, in my story, benzodiazepines, sleep aids, but also behaviors like gambling, shopping, pornography, Twitter, Facebook, Instagram, iPhones, eating, and on and on. And for all of these addictions, the natural history is very similar, and the change in brain chemicals like dopamine is the same. I think it's important to point out that anybody, regardless of social standing or income, can become an addict. It crosses all social demographics. But what addiction is not is a moral deficit. It is not, many people want to say, why can't she stop drinking for her baby? Why can't he stop drinking for his wife or his family or his job? And survey after survey of Americans admit that there's very likely a biological determinant of this disease. There are certainly risk factors for addiction, genetics being the top of the list. About 50 to 60% of the risk is genetic. This is based on biologic family studies. So you are certainly at risk of becoming an addict, whether it's with substances or behaviors, if you had a parent or grandparent who is an addict. This is likely polygenic and complex and not well understood. It likely has to do with problems with impulse control and inability for delayed gratification. And so much more research needs to be done on this. Other risk factors are co-occurring psychiatric disorders, which was discussed previously. Trauma, this can be big T trauma, this can be little t trauma. It can be one-time trauma or ongoing trauma. Employment status and poverty are certainly risk factors. And access is a huge risk factor. We live in a world of virtually unlimited access to whatever our addiction might be, whether that be substances, screens, social media, gambling, etc. And unfortunately, you may have none of these, and that is not necessarily protective. For a long time, I think people had this idea, and Vic touched on this earlier this morning, that addiction is sort of a downstream consequence of problems in life. So here you see on the arrow problems mount, and this leads to a slippery slope towards addiction. And there's no doubt that trauma or loneliness or isolation can play a part, but these are certainly not required. In fact, it is much more likely that addiction is its own problem, and you can have a perfect life, be very successful, and still get very, very addicted. And so everybody that I knew when I realized I was an alcoholic, they were looking for the reason. And my wife would ask me, "Why are you an alcoholic?" My mom would ask me, "Why do you think you're an alcoholic?" And as an alcoholic, I wanted to know the reason. I wanted to figure out the reason so that I could rationalize it. I wanted to be able to figure it out. My friends and families and colleagues who I shared this with wanted to figure it out. We are storytellers and really want to be able to tell the story. So going back to my my story, when I was in fellowship, I couldn't understand why I was angry all the time. Mostly at home, and thought maybe it was because of depression, that co-occurring psychiatric disorder I talked about a few slides ago. So I began to see a therapist, and of course, we explored the root cause of these issues, and alcohol use came up. The problem was that when he asked how much I drank, I was aware of the socially acceptable answer. I was aware of the clinically acceptable answer. And I had no interest in stopping drinking. So I told him that my drinking was less than it actually was. And there's no doubt that lies and manipulation were part of my disease. And in some ways still continue to be part of my disease. So instead of being prescribed rehab, I was prescribed Lexapro. And the drinking went on. And I finally decided to get sober a couple of years later. Not only did my wife not trust me, I also lacked a good story for why I was an alcoholic. Well, I did have the genetic predisposition. I didn't really have a significant trauma history. I was successful. I achieved my goals. But I continued to build up these poor coping skills. It was clear that as problems started mounting up, patterns started emerging, and they finally caught up to me. I finally had to accept that I was an alcoholic because I was an alcoholic. And there may have been nothing that I could have done to change that course. So for the next few slides, I'd like to talk about the stigma that Dr. Kranz started talking about in the last presentation, to help kind of destigmatize the substance use and alcohol use that healthcare workers think about, because as she showed, there is certainly still stigma that exists. This is a paper that came out in 2015 in the American Journal of Addictions. It was a survey examining the prevalence of substance use disorders among American physicians, and a few things stood out to me. When you look in the left-hand side of the table, you see the symptoms of alcohol abuse or dependence by this the screen tool audit C. I've highlighted some of the percentages that stood out to me. So less than 35 years old was certainly more represented than older physicians, but also you see that above 55 still represented a large number of physicians. Surprisingly, you can see here in this survey that females outnumbered males. And if you're single or married, that is maybe a little more protected than partnered. You can see among all of these, the point is that there's a large number of physicians who are at risk for alcohol abuse or dependence. The next part of table 2 show that more physicians who were alcoholic, abusers, or dependent had no children. They had less experience, less than 10 years of experience compared to the folks with more experience, and working 40 to 60 hours seemed to be at a risk compared to people who worked less than 40 hours or even people who worked more hours. And I think that, figure 1 from this paper shows that there really is no specialty that is immune to substance use disorders among physicians. So the red bar shows the average risk, and it's about 13 or 14%. You see the x-axis is the percent of respondents with symptoms of alcohol abuse or dependency, and the y-axis is the different specialties. You can see among the group that we have on the call today, OBGYN is slightly above the average risk in this publication, coming out about 15%. And pediatrics Now that's 12 or 13%, and pediatric subspecialties come out closer to 15%. So if you take these numbers, just take for say the average risk of 14 to 15%. At the University of Colorado section of neonatology, we have around 30 faculty members. So by statistics alone, I am likely not the only person in the section dealing with addiction issues. And statistically speaking, there are probably 2 to 3 other members struggling as well. In the Department of Pediatrics at University of Colorado, there are over 900 faculty members. And so I think you can do the math. And this does not include nurses, PAs, nurse practitioners, pharmacists, respiratory therapists, and other healthcare workers that work in the hospital. The question then becomes, why don't healthcare workers seek help? Why did it take me so long to seek help? Part of the problem is healthcare workers are very smart. They're very highly educated, but these two things alone are not protective against addiction. There's some data to suggest that it may even make us more vulnerable because we are less likely to seek help. We are more likely to think, I know when I need to cut off. And this is not just an exclusive thing to physicians. A great article in 2017 talked about lawyers in addiction and recovery, and how I love the idea of a web of drug abuse in his profession. That's same for healthcare workers. Other ideas about healthcare workers and addiction, like I said before, we think we will know when we cross the line. And of course, we have more access. We have access to opioids and benzos and ketamine, and we can ask our coworker if we're an addict. Like Vic was talking about, we will do anything for our addiction. So we can ask our healthcare workers, "Hey, can you prescribe me some Ambien? I'm having trouble sleeping." And so certainly the wheels are spinning against us as healthcare workers if we're prone to addiction. And of course, there comes a lot of shame, right? A lot of shame that Vic talked about, and Dr. Cran showed in some of her data. The shame and the stigma is still very much a problem, even among physicians and nurses and other healthcare workers. And I think we need to remember that doctors and healthcare workers are regular people with regular problems. There's a hesitation to get help and share the story because the shame of being a healthcare worker and addiction is more pronounced. There's a sense that the healer should have it all together. And people in general are afraid to disclose their vulnerabilities. Brene Brown has whole books on this. And so healthcare workers are probably afraid to, or maybe we're even trained to just, to not disclose our vulnerabilities even more than in the general public. I think this is changing, but it's still very much a part of the culture. In the past, when a physician writes his autobiography or her autobiography, it's often to tell the story of how he or she became a superhero, how they developed these efforts and that they had achieved to save a life. And so this adds to the shame and substance abuse that addicted healthcare workers may have. Thankfully, recently there are several publications and books from physicians who are helping to destigmatize some of this. Adam B. Hill is one of the probably leaders, at least on Twitter, among physicians and healthcare workers in recovery. And he published this book, Long Walk Out of the Woods, last year. Abraham Verghese is an internal medicine doctor, and he talks about a trainee who suffered from alcoholism and a tennis partner. And then Anna Lemke is a psychiatrist who just put this book out earlier this year, Dopamine Nation. And she not only talks about substance abuse in her book, but also behavior addictions that can certainly make us vulnerable to the problems that the addicts can have. And then recently, in the last few years, New England Journal of Medicine has been publishing some perspectives on self-care and recovery. Again, this is by Adam B. Hill again. It was published in 2017. More recently, JAMA has published some perspectives called Oblivion and Breaking the Silence. Great reads for anybody who wants to learn more about this topic. I talked before about how addiction is a disease or a choice in addiction. And certainly, the prevailing thought is that addiction is a disease. There is certainly an element of choice. And I loved how Vic was talking about this morning. There is an element of choice in addiction, that is the choice to get help. We may not have the choice to use or not. We have a choice to surrender to the idea that I need help. I need to hand this over to someone who can help, and that takes a lot of courage. And as a sort of a measuring stick, it might be helpful for those in addiction to look for help when the pain of perpetuating or continuing down the path that I am on is greater than the fear of letting go and trying something new. So that was the tipping point for me. How can I keep living this life of lies and manipulation and hurting the people I loved? How can I do that instead of just letting it go and trying something different? Like I said, I tried quitting hundreds of times, and clearly that wasn't working, so I needed to try something new. So what is out there? What can help? I think a lot of us know about 12-step programs from popular media and a recent Cochrane article published a meta-analysis suggesting that there's high quality evidence that Alcoholics Anonymous or 12-step programs are more effective than other established treatments such as cognitive behavioral therapy for increasing abstinence, maybe at least as effective as other treatments for other alcohol-related outcomes. And it also produces substantial healthcare cost savings. So Alcoholics Anonymous was established in 1935. And since then, there are now several similar 12-step type programs for other substance uses and behavior addictions that I mentioned earlier. Abstinence is certainly the ideal for all of us who are addicts, but sometimes we need more help. As I mentioned, therapy can help if you're honest. It didn't work for me when I was using because I was not honest, but now I use therapy, and it's really a pillar of my recovery. There are rehab centers. This Cedar just happens to be the rehab on the campus of UC Health. And many people go there, get treatment. There's the Colorado Physician Health Program, or CPHP, that can help monitor physicians who need a little extra help to overcome their addiction. And really, one of the goals for the CPHP is to keep patients safe. There are a number of medications, some of which Dr. Kranz discussed in the last presentation, like naltrexone, buprenorphine, Vivitrol, which is an injectable form of naltrexone. Some of these have varying degrees of success. And then every year, it seems like there's some other new idea, and kind of a more recent one is using psychedelics from mushrooms and so forth as a way to not only treat psychiatric disorders, but also perhaps addiction. So I'd like to just conclude by talking about how my darkness was flooded with light. what are some of the things that I do? I'm certainly involved with 12-step programs and the International Doctors of Alcoholics Anonymous. That's IDAA.org. But a daily process that I do is certainly in meditating and practicing spirituality and faith. I listen to podcasts from folks like Vic. I have leaned into playing music. I play a couple of instruments in a band and attend lots of live music with my wife. Because yes, we are still married. We did get through this, or have gotten through this so far, I should say. And the truth is, I just continue to deal with cravings from time to time, especially in these days of the everlasting pandemic, high hospital volumes and worrying about the health of my family and friends. I continue, as I mentioned before, I see a therapist and take medication for anxiety. I am acutely aware of sleep hygiene and the need to live in a healthy way. I really try to be present with others and to myself. It's my own attention, my energy, and my needs. I embrace gratitude. I embrace truth-telling now. Honesty, and rigorous honesty is a big part of my program. I also embrace humility and surrender and vulnerability. And certainly, these have variable amounts of success on a day-to-day basis. And what I continue to look for is progress rather than perfection. Because as I discussed earlier, perfection is a big problem. Why I might have, had poor coping skills. And I find that patience is a virtue that cannot be overstated and that I have to work on constantly. I work with other alcoholics and share my story and my hope for them. And a big part that I'm very proud of that I now lead at for the NICU fellows at University of Colorado is issues on resiliency and wellness. And it's not me talking to them, giving them lectures on, you will be resilient if you do ... It's us discussing as a community, tools and insights into recovery and wellness and resiliency that we can add, so that we can add these tools to our toolbox, that is needed for the work that we do and to live on life's terms. I'm very grateful for the invitation for me to share my story with you, and I thank you so much.
Thank you so much, Rob. That was, I know, incredibly difficult for you to do, and we so appreciate your openness, your vulnerability, and your courage. We could take one or two questions if folks would like to chat in or unmute themselves. I'll ask a question. Obviously being a physician, being your colleague, a neonatologist, was part of your fear about being open, fear that you wouldn't be able to practice medicine?
That's a great question. I think there's a lot of truth in that. Like I said, I didn't have problems. I didn't have consequences at work. But and really, I think when I sought recovery, I didn't know what the potential consequences would be professionally. Now that I've spoken with many healthcare workers, there certainly are people I know who have lost their license, and people who have been able to gain it back. And I think there's a lot of strength and hope in hearing about those stories as well.
There's a question here. What's the best way to support a friend or coworker who may be in denial of their substance misuse, and after it's identified or while in recovery?
Yeah, I think from my experience, it is just to, for the first question, who may be in denial of their substance misuse, I would refer them to somebody who maybe is in recovery to talk to them about their story. I think when when we, as friends and family who are so devoted to these people and just want to see them get better, but we start like, probably not the right word, but suggest strongly that they should seek help. Whenever somebody tells me I should do something, I kind of stop listening. You should think about getting, looking at recovery. I'm not going to listen to that. But if I can hear somebody else say, I've been through this, I know what you're going through, that's a lot more powerful.
Great. Well, thank you so much, Rob. We
Yeah.
appreciate your time.
Yeah, thank you so
sharing.
much.